Well, thank you so much for joining us today. Can you tell me a little bit about Aeon?
Yes, Aeon is a clinical management company that was developed to manage asymptomatic heart disease through technology, through advanced technology.
And Brian, may I ask you why specifically cardiac diseases?
Well, cardiac disease is the number one killer in the U.S., and who wouldn't want to address that using new technology and new thinking that has produced dramatic results for patients and physicians in outcomes. So if you can take new technology, lower the cost, lower the risk to patients, and produce results much faster, why wouldn't you want to do that on something that has such a dramatic effect on the population?
Okay. Describe to me what is the new technology that Aeon works with?
So it's an advanced CT. Historically, when you have chest pain or you've got a clog in your artery, to make it more simplistic, you usually have to go and have an invasive procedure called a heart catheterization. You're admitted to the hospital, they do an invasive procedure, they put a wire up into your femoral artery and they put radiation fluid in there and they take x-rays, and that's how they see whether your arteries are clogged or not. It's very expensive, around $28,000. The new technology is less than 3 seconds. It's non-invasive. You go into a scanner, they take one rotation of your heart, you get less radiation, and you have a 3D image of the heart, which allows you to see inside those arteries and veins to see where the clogs are.
Okay. Has this technology been around for a while, Brian, or is it, how old is it?
That's a good question. So the CT technology has been around for quite some time, but there's been dramatic advances in its ability to image patients. And so when she talks about using 320 slice CT, it can image a much greater area of the anatomy in a much shorter period of time. So you may hear comparisons with other studies that looked at differences between traditional angiography in a cath lab and modern CT angiography. And they use scanners that weren't as capable as the 320. In addition, with the Aeon program, we've worked hand in hand over the last 5 years with groups of cardiologists to understand the correct treatment protocols and image protocols. So it's not just the machine, that's the basis. It's the use of the machine, so what we would call a protocol, that allows for this advanced capability. So it's a combination of really smart physicians, a large group of them, studies on thousands of patients, and then the application of this technology using their education and background.
It sounds like a real game changer, so why aren't we seeing it more readily utilized with patients who clearly need it?
Well, that's a very political question right now. Healthcare cardiologists finding it difficult to accept new technology. A lot of cardiologists have what you call nuclear machines in their offices, and which generate lots of revenue for them. This CT technology eliminates the need in most cases, so about 80% of the time they would no longer need to use those expensive piece of equipment in their offices. And like Brian just said, it's not all patients, so we have develop the treatment guidelines to specifically pick out those patients that we know we can get a good image on, so we can really see what's going on inside that heart. And not all patients are applicable for that type of procedure.
And the rest of that is, old habits die hard. And so many people question new technology because it is new and they think it hasn't been proven. And so they tend to fall back on what they're used to and what they're accustomed to. And CT angiography has been a great tool. It really has. It's done great things for people. But what we've found is there's a great deal of those that are unnecessary. And because they're high risk and costly, we found now that they can be eliminated. So real quick statistic, multiple studies have shown that physicians that own their own equipment are 3 times more likely to order exams than those that don't. And so that's part of why we want to try and change the game here, to provide an uninterested third party, if you will, that will provide the technology and treatment protocols. Now, what's important to note is the cardiologists are still going to be involved in this. very closely involved, just like they would with the patient if they were treating them on their own piece of equipment. So they're not being excluded from this. This is just new thinking and using new technology.
Yeah, the other thing that I think is important for everybody to know is 50% of all heart catheterizations are diagnostic. And what that means is when a patient has this invasive procedure, it comes out normal. They should never have had this procedure in the first place. So you've accumulated that level of cost. 2% of the patients that do have a heart cath that is normal get really bad side effects and really bad conditions from it and die from having a procedure that they shouldn't have had that came out normal. Now, we've done some studies on the Medicare population, and we've identified that using our treatment protocols, we would be able, if this came out into mainstream America, to save Medicare alone between $3 and $4 billion, which is significant. So we're in process right now with one of the major health plans in the state of Arizona in putting together a commercial pilot program to go at risk and to roll that out in the second or third quarter of 2015, because all of the studies have been done in an academic setting.
So an important question might be, why Arizona? And the reason for that is under an exclusive arrangement with Marquee Diagnostic Imaging that has facilities in Arizona, this is being provided. What's more important about that is they have the only 2 of these machines in the whole United States in an outpatient setting. So that's how this development and testing has happened. It hasn't been in the hospital, it's been outpatient, which is the whole point. We don't want to bring patients into a hospital and do an invasive procedure. We want to let them come in, get the exam, and leave. And so that's why it's been developed in an outpatient.
Okay. We have 5 years worth of R&D on this. So Aeon, with Marquee Diagnostic as partners, have spent the last 4 years putting together these treatment guidelines using this equipment. We're very confident about who our selected patient population is to have this. Those that aren't appropriate can have it the more traditional way. They can go for the nuclear scans at the cardiology office, or they have to go straight for a cath. But at least those that will be having caths, we will know that they should be having them because there's a real reason for that to happen.
Okay. Well, I think we've covered quite a lot, so thank you to you both.
Thanks for letting us
Thank you
talk.
for the opportunity.
Appreciate it.
Thank you.